Long sleeper syndrome is characterized by the need for more sleep than what's typical for your age group. Keep watching to learn more about this disorder, its symptoms, and coping mechanisms. You're grown and on your own, supposedly living life to the fullest. Well, you would be if you didn't need 10 hours sleep to feel alive in the morning. Evening gatherings and social events are uncomfortable due to this need for sleep. You come across as antisocial to your friends who don't understand your elusiveness. Say you bite the bullet and go out with friends for the night. Unrelenting drowsiness sets in, and you can't keep your eyes open. The next morning, you feel unbearably tired. If this describes you, you may be suffering from long sleeper syndrome. What is long sleeper syndrome? Long sleeper syndrome is a sleeping disorder that causes a person to sleep for longer hours than what is considered appropriate or normal. Typically, long sleepers need more hours of sleep to feel well rested and refreshed. This means they tend to sleep between 10 to 12 hours every night. What causes long sleeper syndrome? Long sleeper syndrome cannot be narrowed to any specific cause, but there are risk factors that increase the susceptibility to the condition, like depression, lifestyle choices, alcohol consumption, cancer, high blood pressure, seizures, hyperthyroidism, coronary heart disease, obesity, and the use of drugs such as benzodiazepines. Sleep conditions like obstructive sleep apnea or restless leg syndrome are known risk factors for the syndrome. Studies have shown that socioeconomic factors such as unemployment, working long-term night shifts, and being single or divorced can increase the chances of having long sleeper syndrome. Keep watching to find out about long sleeper symptoms, co-occurring conditions, diagnosis, and treatments. What are the symptoms? The daytime symptoms of long sleeper syndrome are similar to insomnia and include sleepiness, excessive sleeping on weekends, frequent lengthy sleep, lethargy, and difficulty waking up. What conditions co-occur with this syndrome? Long sleeper syndrome is associated with many conditions that can complicate or occur alongside long sleeping. These conditions can be sleep-related, psychological, or medical. Long sleeper syndrome can be associated with frequent sleep fragmentation, meaning you wake up continually throughout the night, like with disorders like sleep apnea, where your body wakes you due to insufficient oxygen levels. Dysfunctional immune function, depression, heart disease, hypertension, increased mortality rate, and disruptive social relationships are co-occurring with long sleeper syndrome. How is the disorder diagnosed? Long sleeper syndrome could be an indicator of an underlying medical condition or another sleep disorder like sleep apnea or restless leg syndrome. If you are experiencing any of the symptoms, you should see a doctor for an accurate diagnosis. How is long sleeper syndrome treated? If the syndrome is caused by a primary medical or psychiatric condition, it needs to be addressed to treat long sleeping tendencies, alleviating your need for excessive sleep. Doctors may recommend coping strategies to help you deal with your symptoms, such as going to bed earlier to address your chronic sleepiness, strategic napping, and discontinuing the consumption of stimulants like coffee. Long sleeper syndrome can negatively affect your life. However, it can be managed and will improve over time with proper treatment. Help is available.